Beverly Hospital, to me, I can remember at 5 years old walking up the front stairs where the pillars are to visit my grandmother, and it being a very small, compact unit, to now when you walk in the front door, it's vast, it's very departmentalized. The community has grown so much since I was little, and the hospital's grown right along with it. For the better, I think, because healthcare has changed so much.
Hi, I have a question. This is Erin Taylor calling from the Breast Health Center at Beverly Hospital at Danvers.
The advancement of our nursing practice has been quite evident in almost every area of the hospital.
You know, it's exciting to be kind of on the cutting edge and, you know, trying to make improvements in real, patient care and saving lives.
Morning, Diane. How are you? There are many, many specializations now, which is great for the patient. It's wonderful for the patient and the staff.
It's an exciting place. People are very well qualified. Our nurse educators are all masters prepared. Many of them have worked in large city hospitals, but many people eventually have settled at Northeast hospitals because it's such a great place to work.
And I think the fact that our staff and their families come here to get their care, both in obstetrics and in the hospital, speaks volumes.
I have worked here at Addison Gilbert for 20 years, and prior to that I worked at Beverly Hospital for about 16. So I've been around for a really long time. And when I came to Gloucester, I actually worked in maternity and did a bunch of different jobs, but as I was working in outpatient, the oncology opportunity came to me, and I love it. I absolutely love it. I've been doing it for about 17, 18 years.
The staff who choose to work here and stay here, they have pride in this hospital, pride in it that they want their families to come here. Say, this is my hospital, my family comes here.
These folks live here and have been here forever, and their heart and soul is devoted into this.
Hi, Patty. How are you? I feel over the years, and having worked in many different departments, that our voices are heard much more now than they ever were. And you use 2 leaders, correct? The concept of patient care now is more of a team effort with management, staff, everything other than management telling us what to do. We're allowed to feedback, we're allowed to discuss different things, we're allowed to say this is what I think we should do and have somebody listen to it.
The nurse who feels respected and valued will go out and perform. And we see that all the time, over and over again. The support that the nurses get at Bay Ridge is incredible.
Up, 2, down. I think it's a good place to work. I like being a nurse here, and I try to portray that to my family, to my friends, to everyone, that it's really a good place to be.
All right.
How is she solar, or is she, what's going on?
We are doing really well. Northeast Hospitals performs very well when we compare ourselves to both the state as well as the national averages. We're really kind of excelling in a lot of different areas.
We were awarded the Advance for Nurses magazine Best Nursing Team for 2009.
We beat out 56 other hospitals for the award, and we were the best team of the year. And I think the team, it's true, I think that they set the tone, the nurses set the tone for what they expect. The patients benefit from it.
Are there any comfort measures, one-to-ones? Okay, we got 1, 2.
We participate in a survey called Press Ganey, which benchmarks our patient satisfaction against thousands of other hospitals across the country. And Addison Gilbert Emergency Department always comes up on top.
I guess he doesn't like being on camera.
There's a huge caring aspect to nursing, and that's quite obvious. But also nurses need to be technically competent.
The changes in the past 7 years are many, from obviously the main entrance to the ER, to the floors, the renovations on the floors. We're also coming along technology-wise. We just instituted provider order management.
It's what I've been doing for the last 9 months, so it's like I don't know how to talk about anything else.
By 2012, Mass state law says that all inpatient units in an acute care setting have to have some form of computerized provider order management, which is physicians are essentially putting their orders into the computer. POM helps with clarity of the order. You no longer have to decipher handwriting. It also allows for when the physician's ordering drug-drug interactions, or if they're trying to order something the patient's allergic to, they'll get an alert. It's a safety mechanism, really.
Definitely.
It's just overall a clearer way to communicate between physicians and nurses.
Every year, our Patient Care Services Division creates some goals for the upcoming year. And last year, really, we focused on a number of goals, but one of them was advancing our care and competence of care of the elders. And we just received niche designation for nurses improving care for health system elders.
This was an initiative by the nurse manager at the senior adult unit, Ms. Shirley Conway, who realized that to enhance and continuously improve the care to the elderly patients on that specialized unit, that the staff need to continuously improve their levels of service, their levels of understanding, and their levels of clinical care to the patients.
This project's been exciting because it's really an interdisciplinary project. So we're really working with not only our nursing staff, but collaborating with the physicians, the pharmacists, physical therapy, respiratory therapy, to put together patient care plans that are best based on what the research is telling us.
Okay, for you right now, I don't want you talking while you're exercising, okay?
We are now a niche system, which means all of our facilities are niche credentialed.
There's only 10 hospitals in Massachusetts that have received it, so we're very proud of that designation as we move to advance our care of elders.
What drew me to Northeast Hospitals and what is unique about Northeast Hospitals is that it's very high-tech. Certainly we have great opportunities for our patients in terms of excellent care, but it's also a very genuine place.
He did a good job.
I work with the best nurses there ever could be. It's because of them that makes coming to work enjoyable. We all work together as a great team on J2.
Oh, thank you.
Everybody just kind of reaches out and helps each other. I think that's one of the wonderful things about being here.
When I think about it from our perspective with people having their baby, it's one of the most special moments in their life. And it sounds simple, but I think that it's complex, and I think that our nurses do a fabulous job with that every single day.
I think it's extraordinary nursing care, but it is only as good as that with the physicians. We work collaboratively with them. So I do think that that's such a good piece of it, is having such a great group of physicians that these nurses are teaming up with to deliver nothing but great care.
We'll get you some lunch. A good nurse, one thing in my career that stands out, I think probably the most of anything else, was when I worked in the emergency room. And this young man came in who went into cardiac arrest while he was jogging. He was 42 years old and had 2 children, and he didn't make it. And we put, before the family came in, I'm gonna get teary. We went and got warm blankets and covered him and wrapped him up in warm blankets, so when the wife touched him, he was still warm. And she wrote the most beautiful letter thanking me for that. I still have it. And that's probably one of the proudest accomplishments of my whole life. When anybody asks me what nursing is to me, that's what I answer.